All right,
It does.
you're rolling.
Okay, so today we're going to be doing a palpatory assessment of 6 muscles on my patient here, Don. To start off, we are going to be looking at the Fibularis Longus muscle to talk about some risks and benefits for this muscle. This muscle helps movement of the foot in eversion and plantar flexion. So some benefits for this is that if we assist in palpating it, then we might be able to help resolve any problems with it by checking the tone of the muscle, seeing if there might be possible injuries or trigger points, which is important, and it gives us vital information on the muscle that helps us treat. Some risks are that the patient might, if my hands are cold, they might feel startled. Obviously, any form of manual therapy has the potential chance to injure the patient, though obviously we won't be, we'll be going gently, and so we likely won't do that. So for the bony landmarks, though, of this, we have, of course, the origin of the muscle itself, which is the lateral side of the head of the fibula, which is right around there. So put that right back. On my patient here, it's easier to tell, but if you couldn't, some other bony landmarks are important to know. So for instance, you have the patella here, the kneecap, it's more commonly known. You also have the shaft of the tibia, also commonly known as the shin. You also have the tibial tuberosity, which is usually located just below the knee. It's very prominent on my patient here. It's right there. And of course you have the fibia, which is the shaft of the bone that the head of what we're looking at is right up here. So to begin trailing the muscle, we're going to first palpate for the head of the fibula. The easy way to do that is to find the tibia, which is easy for just palpating for the shin. We then go lateral to the side, and we find a bony shaft. It should feel hard and have no resistance, so I can find it right there, and I'm going to simply move up until I find the head, which is right around here. So now that I've found the head of the fibula, I will be, I know that I'm on the origin of Fibularis longus, and so I'm going to be palpating it down the leg. The fiber direction for this muscle is in a crisscross, going like that, a little bit superior medially. So I'm going to palpate with that in mind, palpating cross fiber direction. As I come down here, the skin is more taut in this area, so I'm going to switch to my thumb. Also, now that we have reached a more lower part of the leg, the Fibularis longus is starting to turn a bit more into a thinner tendon. As it goes further down still, we are able to actually see it on the patient, and it is going to pass under the lateral malleolus of the ankle, as it is just now. Then it is going to travel under the foot and eventually attach on its insertion at the base of the first metatarsal, like the great toe here, though you can't feel it because it's quite deep. For the action of this muscle, since we've already stated the origin and insertion, it plantar flexes the foot because of its fiber direction causing it to go down, as well as everts, aka turning the foot out like that. So for how to activate this muscle to make it easier to palpate, we simply ask the patient to resist our force that we're going to apply. So to do this, I'm going to apply an inversion force and plantar flexion. This way, that when the patient tries to go against this force, when I ask them to evert and plantar flex, it's easier for them to understand. So just do that for me, please. So now, if the patient is doing this correctly, I should be able to palpate for the muscle again and find it even easier, which I am able to do. and I can more easily follow this muscle. Okay, you can stop. Also, while doing this, it's important to remember the 4 T's, which are the basis of palpation, which is temperature, tenderness, texture, and tone. For temperature, we're ideally looking for it to be warm, as human beings tend to be, but not too hot, as that might indicate inflammation, which is obviously a bad thing. During my palpations of Dawn, she appears to be of fine temperature. Tenderness is usually given to you by the patient themselves. So you might ask, do you feel tender when I palpate here? So do you feel tender when I palpate here?
No.
Good. So that's a good sign. If that wasn't the case, then that might be problematic. Then for texture, we're looking things like muscle rigidity and whatnot. Ideally, the muscle would be soft, supple, and easy to manipulate. For the last one, tone, we're looking at whether it's hard or soft is the general distinction. If the muscle was high tone, that might indicate that it's under a lot of stress, which in a state of rest, as the patient is now, that would be a problem, though thankfully her tone is fine. Moving on to the next muscle, we have Fibularis Tercius. Also, often these muscles are, instead of fibularis, it's called peroneus or peroneal, but I prefer to use Fibularis. So Fibularis Tercius, it is for palpating this muscle, the risks and benefits are the same. We're trying to find the information about the muscle that could be invaluable to learning about it. So for bony landmarks around the area, we again have the shin, but a little bit more of a lower down section. We also have the fibula. A little bit closer to it now, we also have the structures of the ankle, the lateral malleolus, the talus, which is the bone that the tibia attaches to primarily when connecting into the foot. You also have the calcaneus, also often referred to as the heel. For the trailing of this muscle, we simply find roughly the distal or lower third of the fibia, and this area is going to be roughly its origin on the anterior lower third of the bone. Unfortunately, though, it's buried underneath other muscles, so it's virtually impossible to palpate through its origin. That's why we instead go down to its more palpatable attachment on its insertion at the base of the, at the top of the top surface of the base of the 5th metatarsal. And so we simply, for that, we go to the pinky toe, come down, palpating the 5th metatarsal until we reach its base, and right around here. So it is a relatively small muscle on many people, so we'll have to activate it to confirm. But the action of this muscle is to dorsiflex the foot and to to dorsiflex and evert. So draw the foot up and then turn to the side. The fiber direction for this muscle is vertical because it's very thin. Okay, so for testing this, I'm going to ask the patient to try and pull the foot up and outwards while I do the opposite. So I'll do that. Also, while doing that, I'm going to look at the toe here, or the area. Okay, good. Now that I've found it, you can relax. And now that I've found it, I can trace it back to its area just to confirm that I was correct in my original assessment of its location. And yes, I was right. So the muscle would go up here just to trail it again. Go up here and then go bury deep into the muscles that kind of go over it. And then we trail up into its origin around here. For the 4 T's, we're looking at the same things, temperature, tenderness, texture, and tone. So I have not sensed any abnormal temperature. Was there any tenderness you experienced?
No.
Okay, the texture appears to be supple, which is good, and the tone also appears to be soft, which is standard. Next, we're going to be looking at the Flexor Pollicis. Well, that one requires a little bit of work while you're on your stomach, so we're going to skip that to continue with ones we can do with you in this position. So we're going to look at Flexor Digitorum. Sorry, that one's also on this side. Extensor Digitorum Brevis now. So Extensor Digitorum Brevis is located on the top of the foot. It originates from the frontal lateral aspect of the, frontal medial aspect of the calcaneus, and it extends and inserts onto the top of the second, third, and fourth metatarsals. The actual insertion, though, is into the tendons of the Extensor Digitorum Longus. So, and its action is to simply extend these muscles, or extend these digits, sorry. So, for activating this muscle, also the fiber direction is a little bit crisscrossed superiorly and laterally. So to activate this muscle, I am simply going to press down on these 4 digits and ask the patient to try and lift them up and extend them. Okay, so these muscles don't tend to be too strong, so we're just going to try and feel for them and get a little bit. Just to clarify, I'm going to feel around for where their origin is, just to clarify that I'm on the right area, and it feels like I am. Okay, good. You can relax. For trailing, it's quite a difficult muscle to trail because of the muscles that are over it, but generally I like to go from the insertion point at the Extensor Digitorum Longus tendons at the toes, and then follow it through under like this until it eventually buries into the foot around here. So for the 4 keys of that, the temperature seemed fine. Was there any tenderness?
No.
And the texture seemed, again, supple, except for around the tendon part, which felt a bit firm, but that's common in tendons. And the tone was also relatively soft, which is good. So for the next one, we're going to do Extensor Digitorum Longus. This one originates from the anterior it originates from the anterior top 2/3 of the fibula, and also connects a lot with the interosseous membrane between the tibia and the fibula. So for palpating this one, I'm simply going to again find the fibula. Bony landmarks in this area I already went over: patella, tibia, fibula, and mater. We also have ones I didn't go over, the medial and lateral condyles of the knee. Right here. So for palpating this, we're simply going to palpate the anterior surface of the fibula, feeling for it. It should be coming down here. The fiber direction for this muscle is mostly vertical, but it kind of curves a bit to the lateral aspect. So as we feel it going down, it will abruptly spray into a number of different tendons that will shoot into the digits 2, 3, 4, and 5 of the toes here. It will attach at the distal tops of the phalanxes of the toes here. So for activating this muscle, I'm going to press down here. Oh, also for the action of this muscle, it extends these toes, and that's pretty much all it does. And obviously it would assist also in dorsiflexion. So I'm going to apply pressure downwards on these toes, and I'm going to ask the patient to resist. More so we're going to try and keep the foot stable, but just try and lift up with these toes here. Good, great, okay. That allows me to see the tendons very clearly, and they feed all into here. So some patients obviously might not be blessed with such visible tendons, in which case you might have to be a little bit more precarious when trying to find them, finding the origin and trailing them up. On this patient it's a lot easier, which makes it convenient. And then you kind of gain palpate it along to its eventual origin up here. So for the 4 T's, the temperature again felt pretty much fine. Nothing out of the ordinary, except for a bit cool, but it's cold in here, so it's not surprising. Did you feel any tenderness?
No.
Good. The texture was also, again, supple, little bit firm around the distal end where the tendons are, but not uncommon. And the tone was standard. So for the last 2, I'm going to have the patient move onto their stomach. So if you could just do that for me. Okay, so these next 2 muscles we're going to do first is the flexor Digitorum Brevis. So this muscle originates from the obviously the inferior aspect of the calcaneus, aka the heel, and it originates from the middle of it. And then it extends down, branches into a number of tendons, feeding into the 2nd, 3rd, 4th, and 5th metatarsals of the foot at the distal phalanx. Then the action is obviously to flex these toes. It due to its origin, it does not assist in eversion, inversion, or plantar flexion. For activating this muscle, we will have the patient shimmy down just a little bit so that their toes are a little bit off the table. That's enough, thank you. And we will have the patient try and flex these toes against our resistance. So now the patient doing that, I will feel for the muscle. Yep, very palpable right here. Nice. So if you can see it bulging a little bit there, and you can relax. And with that, you can now see.
I get cramp now.
That's okay, you're fine. Yeah, cramping is one thing that can also happen as a risk with palpation, obviously, when doing actions, especially with the foot. The foot tends to cramp for that. So for the bony landmarks of this, we obviously have the 1 through 5 metatarsals. We have the calcaneus, the talus again, and medial lateral malleoluses and whatnot. The fiber direction for this muscle is kind of goes down like this, or in this position it looks like this. If the patient was standing, it would be posterior to anterior and going to the lateral side. Yes, for the 4 T's, the muscle felt a bit cool because the temperature in here, so that's fine. Was there any tenderness?
No.
Good. And the texture felt relatively soft, which is good, and there's no excessive tone either. So for the last muscle, we have the flexor pollicis. The flexor pollicis is the muscle that flexes the big toe. It's a relatively large muscle. It originates from the middle to distal 2/3 of the fibula. So for this one, palpating it it's pretty deep, so it's a little bit difficult to palpate. Generally, an easier way to go about it, though, is to ask the patient to flex their big toe. And you do that, nice. And then you try and find it in here, just branching off of the Achilles tendon, which is right back here. You can also feel it a little bit in the big toe there, as I was able to there. On this patient, it's a little bit more difficult to find the tendon as it branches off from the Achilles, but we'll test again in a moment. For the fiber direction of the muscle, it goes generally inferior and to the medial side. The insertion is at the bottom side of the distal phalanx of the hallucis, aka the big toe. And already went over the origin, the action, which is flexion there. And yeah, so we'll test it one more time, asking the patient to flex the big toe to try and find it in here a little bit more easily. Nice. Okay. Can you do it again? Okay, there we go. Nice. Okay, so found it there. Sometimes looking at the skin movements can help you find a general way to go if you're a little bit uncertain. So for the 4Ts, the area gain seems a bit cool. Not a problem though. Was there any tenderness?
No.
No, that's good. Texture is, again, soft, supple, generally good. And the tone is fine. And that concludes the palpation presentation.